it's Kristen here at UT Southwestern Medical Center. Thank you for joining us today for our chat on autism awareness with Dr. Peter Tsai and Dr. Maria Chahrour. They are both faculty members here at UT Southwestern. Dr. Chahrour is a neurogeneticist with the McDermott Center of Human Genetics, and Dr. Tsai is affiliated with the Department of Neurology. He's actually a pediatric neurologist, and both of their research, however, focuses on autism and autism spectrum disorder. So that's what we are here to discuss today. I want to remind you that we can't talk about very specific medical questions. You really need to contact your physician for that, but we can speak in generalities, and we've got a lot of time here. So don't forget to like and share the conversation and leave your comments and questions in the comments field of your Facebook page. So we're going to go ahead and get started. So welcome, Dr. Tsai and Dr. Chahrour.
Thank you.
Great to have both of you. So I think we're going to, just to get started, what are the main indications that parents or grandparents, loved ones should look for indicating that a child might have autism? Want to take that, Dr. Tsai?
Sure. Autism is kind of by definition kind of classified as, from behavioral criteria. And so, the core criteria being some manner of social impairment, as well as some manner of restricted or repetitive behavior, restricted interest. And so within that context, if you think about anything that would kind of go along with that. So when you're looking at, so during infancy as an example, one kind of early sign is, does your child or does the child respond to his or her name? And often children with autism, this will be one of their earliest kind of signs, if you will, responding to voice. And, because language and social communication is such a big part of social interaction, language is also something that you can look closely at. And so is your child babbling, making the sounds that babies like to make? Often children with autism will not be making these sounds, kind of cooing and babbling kind of on the same time frame as the general population, if you will. Okay. There's a number of other things you can look for, as you might imagine. One of the things that is not well kind of described kind of association with autism is actually motor abnormalities. The vast majority of kids with autism actually have some sort of motor abnormalities, and that's tone, that's kind of praxis, and kind of how things related to motor function. And so sometimes you can see, hey, my kid is a little clumsier, is not developing as fast, is not walking as fast, and some of these can be signs or early signs of.
Okay. So we're starting to get questions in, and this is great. Be sure to leave them in the comments field. And this directly relates to that question we just touched. What is the average age for diagnosis? Is it on the young end? Is it older?
So unfortunately, it's actually on the higher end of things. And so the average age of diagnosis, I think, across the land is still somewhere around 5. When, we would want diagnosis to happen much earlier, on the order of 18 months or even earlier, if at all possible, because, I think the research would show that early treatment begets kind of better benefit. And as a result, the earlier you can find out, the earlier you can get treatment on board, kind of the greater benefit those treatments will have.
Okay. So Dr. Chahrour, I know there are a number of genetic tests out there. Is there a genetic test that's available for autism spectrum disorder?
So the answer is yes and no. We've known for a while now that autism is primarily a genetic condition, and we know that mutations in over 100 genes can cause autism. But with that said, a genetic test cannot necessarily detect autism in an individual, but what it can do is that it can detect specific mutations in an individual that has autism. So, for instance, if an individual is already clinically diagnosed with autism, a genetic test can potentially find the specific mutation that causes autism in that particular individual. Yeah, and so, the more we learn about autism genetics, the more these tests become, informative, and the more autism mutations that we can find. And so, finding sort of getting a genetic diagnosis can potentially alter the course of care for some patients, even though the test is not designed to detect autism.
Okay, so that brings up another question, and thank you for noting you can't hear it. Please be sure to turn up your volume a little bit. We're talking. We'll talk a little bit louder on this end. So, why would somebody who's been diagnosed with autism get a genetic test?
Yeah. So, if the genetic test finds the specific mutation in the individual with autism, it could potentially affect the course of care, as I was saying. So because some of these genetic mutations are also associated with other health problems in these individuals, for instance, seizures or obesity. And we have treatments and course of care for these associated health problems.
Okay.
And of course there are, the main sort of benefit of these genetic tests is that they can answer the why for the individual and their family members. And then, families get sort of the emotional and practical support from the community of other families that have the same mutation and that are going through the same things. And it can also help a family decide, make important decisions about whether they want to have more children or not. And so, basically the knowledge that's gained from these genetic tests, altering the course of care for the individual, but also for everyone else who's dealing with that same mutation.
Okay, so how is ASD, how is it diagnosed? That's a question for you, Dr. Tsai.
Yeah, so I mean, as I mentioned kind of at the onset of this conversation, I think it is behaviorally classified disorder that's defined by these two core deficits, if you will. So it's some sort of impairment of social interaction. And if you look at the kind of the standard official diagnosis, you would want, or you would expect in the diagnosis to have deficits within that social domain of, the social relationships, impairments in kind of nonverbal communication and the ability to kind of interact on a social level. And then in addition, kind of in the second core criteria, if you will, in terms of the repetitive behaviors, some manner of repetitive behaviors, or restricted interests, kind of inflexibility, as well as or the possibility of some sort of sensory disturbance in hyper-responsiveness to sound or to light, this kind of thing. And I think importantly within those two categories, kind of an important part of the definition is that there must be, it must cause disruption in the way, in your life, in your ability to kind of interact.
Okay. Well, here we have thank you for the question. We have one here from Ellen, and Ellen asks, are there different types of autism? You want to start with that one? Different types?
Yeah, so, as a clinician who takes care of individuals with autism, what I would say is if I have a patient panel of 10 kids coming into the center to be seen, what I will just often see is 10 different kids with autism. So autism is a very heterogeneous disorder, because I think because of the behavioral criteria, there are those things, but the other things that are associated with this, whether that's kind of attention abnormalities, you can have motor abnormalities, you can have seizures that were mentioned before, weight changes, obesity, etc., that really kind of give you a huge diversity within individuals with autism. And I think if you want to talk about the genetics.
From a genetic standpoint, we view autism as this collection of individually rare disorders. So it's pretty heterogeneous on the genetic side as well. And even though we know, over 100 genes that can cause autism, we don't have a single genetic mutation that can explain, 1% of cases with autism.
Yeah, so that's a great question, Ellen. So I see another question that came in here, but I want to ask that because you talked a little bit about genetic tests earlier, and this has come up again. What percentage of individuals that have been diagnosed with autism get any sort of answers from genetic tests?
So it's close to anywhere from 35 to 40% of individuals with autism have a specific genetic mutation that can explain their autism. And if the individual also has other associated conditions, for instance, autism and intellectual disability or autism and seizures, those numbers, there's a higher probability to find a specific genetic mutation.
Wow, that's higher than I thought it might be.
Yeah.
So related, here's a question from Christy. What are some common misconceptions about autism? Yeah, I certainly hear quite a few things, but I can't speak to whether they're all misconceptions or not. Any ideas?
I mean, what are common misconceptions? I mean, there
lot.
are so many, you
Yeah,
know, and how
yeah.
much time do we have, I guess. I
Yeah.
mean, I think
Maybe one or two.
well, I mean, I think, part of it is this is a very prevalent disorder, you know, so right now the rates from the CDC is, 1 in 59 children are diagnosed with an autism spectrum disorder, right? And because it's such a heterogeneous population with this diagnosis, I think there are a lot of thoughts, you're going to get a very significant diversity of the disorder, and so as a result, I think there are lots of conceptions of what may affect my child, which may not be pertinent to, other child over here who has autism, because they are, kind of very, they both may have the diagnosis, but be, kind of very different in kind of the challenges that they face, etc.
Yeah, so about the causes of autism, there are a lot of misconceptions
About the causes.
And the genetic side, there's one common misconception that we encounter is, if we say that there's a genetic mutation, parents often think, oh well, is it from, did we pass on that genetic mutation? So genetic doesn't necessarily mean inherited.
Okay.
So a genetic mutation can arise in the germ cell of the parent or in the fertilized egg itself, and not be necessarily, the parent doesn't necessarily have to be affected.
Okay, that's actually a great transition. So if, in this 35% where they identify a specific gene mutation that may be responsible for the autism, could there at some point be a way to reverse the mutation? I think that's a little bit about what you're studying.
Yeah, I mean, I think that's our hope, right? That's what we're working towards, that, first we understand the genetics and find these specific mutations in specific genes, and then to really understand what are the specific biological processes that these genes are functioning in, and then what can we do to reverse that? So there are a lot of steps in research along that line. But one really important consideration for this is the fact that autism is a developmental process, condition, and so as Peter was mentioning, diagnosing it early and intervening behaviorally early has the better outcomes. And so if we are to think about reversing the condition or doing some sort of gene therapy or alternative methods, we would have to think about how early can we intervene.
Okay, great question. So we have one here from Bana, and I believe it's for you, Dr. Tsai. Do you recommend children diagnosed with autism see a neurologist?
So I think, so there are many providers who care for individuals with autism, in particular if you are looking at children with autism, and that can be developmental pediatricians, that can be child neurologists who specialize in caring for kids with autism, and there are child psychiatrists who are also caring for children with autism. So I wouldn't say necessarily, you need to see a neurologist or a psychiatrist or developmental pediatrician. I do think that seeing somebody with expertise in autism, is often very helpful, depending on the specific challenges I think that your child faces. So if your child has particularly, kind of behavioral or issues with aggression, as an example, I think having your child seen by a child psychiatrist would make a whole lot of sense. If your child, for instance, has seizures associated with the autism, then having your child seen by a child neurologist would be, I think, really important. And so those considerations kind of can factor into the exact provider you might want to be caring for.
Right, that's helpful. Thank you for asking the question and for joining us today. That actually, your answer is partly the response for this question from Ellen. Her question is, how do treatments help children with autism? And it sounds like it varies based on the case. Is that accurate to say?
Yeah, so at the present moment, so if you think about therapies, so if we're bringing up therapies for autism, so the mainstay for therapies for the actually core criteria, so those restricted interests and the social impairments related to autism, it really is in the purview of behavioral therapies. And so one of the probably most most well-studied and most well-established is behavioral therapy called applied behavioral analysis, which has been shown to be very, very helpful in improving some of those core deficits of autism. But that being said, I think, as Dr. Chahrour mentioned earlier, depending on, especially on the genetics, et cetera, and depending on the other factors associated with those core criteria, those can potentially be addressed: attention, behavior, aggression, seizures, et cetera.
Good to know. So this one, I'm going to start with you, Dr. Chahrour, and it's, what is on the horizon for autism research?
A lot, actually. It's a time to be really excited about autism research because, just 5 years ago, the genes that we know of today were not known to be, causing autism just 5 years ago. And so the field is moving rapidly. There's a ton of research happening, not just, all over the country, but across the world. And here at UT Southwestern, we have a lot of research programs that are going on. I think the more we understand the processes that are sort of getting disrupted in autism, that's when we can start thinking about avenues for treatments and therapies. So there's a lot to be excited about. It's sort of like where the cancer field was decades ago, right? So people thought, cancer is one thing, but just like autism at the beginning, people thought autism was just one thing. Now we know it's, if you've seen one patient with autism, you've only seen that patient with autism. So it's very heterogeneous, and now we're, finding these subtypes of autism, not just on the clinical level, but also on the molecular and genetic level. So I think there's a lot for us to be excited about. And another big thing in the autism field is the involvement of parents and families, and how, their involvement is fostering research. And so, I was talking about these communities of families dealing with the same mutation coming together, and there are a lot of examples. And specifically for autism, bringing attention to that specific genetic, that specific gene that they're struggling with, and pushing research in that direction. So there's a lot going on. Yeah.
So I know you look at a lot of different pathways. How could identifying specific pathways in the brain help to ultimately develop therapies?
So it's a very it's a tough question. So
I think it's a very important question. So I think
Yeah.
in some, so say kind of along the lines of, what is the benefit of knowing the genes that are involved? And so by understanding the genes and say the signaling, the molecular pathways that might be involved, you get a better opportunity to say, maybe we can tackle this particular autism, this population with autism, with a, some sort of therapy that will tackle this specific signaling pathway as an example.
So like at what
Okay.
point in the pathway should you intervene to get the best outcome?
Okay.
And if you know the specific alternate, like if you know the specific molecular pathway, it also provides you an opportunity that we can target potentially kind of in the future, once we better understand those molecular pathways, target that pathway and thereby in some ways avoiding potential side effects of something that is a therapy that would be more non-specific.
Yeah, so being more specific.
Good to know. Great question. So we are almost at the end. We have 4 or 5 minutes left. So now's a great time to submit those last minute questions. Do you have one in here from Carter already? And her question is, why is early intervention important?
So early intervention, I think, is really critical for a number of different reasons. And so, the young brain has the ability to recover and change in a way that, me in my much elderly state is not able to do. So if you think about learning a language as an example, right? Kids have the ability to learn a language in a way that, I will never be able to get the accent completely right or learn the language. And in terms of in terms of how this affects autism, the same thing applies. So if you think about social interactions and learning the nuances of the social interaction, or, kind of the other things that affect in terms of the repetitive behaviors, et cetera, the brain learns these processes at a very early age. And so in all of the studies would show that the therapy, so the behavioral therapies as an example, the earlier you can apply these behavioral therapies, the greater the benefit will occur. So if, an adult is starting all these behavioral therapies versus a 2-year-old starting all these behavioral therapies, the 2-year-old is going to do much better. And so as a result, because of this developmental changes that the brain kind of goes through, the earlier the diagnosis, the earlier therapies can be applied, and hopefully the earlier the benefit that can be gained.
Okay, so we have another question. This one is specifically for you, Dr. Tsai, though I'd be interested in your response too, Dr. Chahrour. She asked, it's from Jen, and she asks, what is your lab like? So what are both of you studying in your labs?
So this is a great question. And so we, I almost want to say we should start with Dr. Chahrour, because I think there are, with the question about research and what research is going on, I think there's research related to kind of diagnostics and how that's going to then ultimately lead to therapy. So we are very focused on kind of actually what the neural circuits are, and the neural circuits that are contributing to the behaviors that are disrupted in autism. So what are those neural circuits, and how does the brain interact with one another, kind of regions of the brain interact with one another to produce social functions, and how does that go awry in individuals with autism, with kind of a view towards, if we can understand what those circuits are, can we actually modify those circuits and modulate those circuits in the same way that has been used for depression, for Parkinson's disorder, etc., that actually may provide benefit for individuals, whether it be children or adults with autism.
Wonderful. What about your lab?
Yeah, so my lab's interested in finding the genes that cause autism, and then in understanding what specific biological processes they function in. And we also, our ultimate goal is to be able to target these specific pathways. We don't necessarily focus on neural circuits, but whatever pathway that the genetics leads us to, we go down that path. Yeah.
Well, I think you both may have just recruited a new lab member, but we've got one final question. This one is from Ellen, and I've heard this before, but based on your research and what's going on out there, do you foresee a time when autism might become preventable?
I'm hopeful.
Yeah.
That I don't know necessarily preventable, but treatable. I'm hopeful that we are heading that way with all of the research that's happening. Yeah, that's our goal, all of us, I think.
And I would echo that sentiment.
That's great. Well, we are just about out of time. I want to give both of you a chance to, if there's anything you want to add to the conversation that's important about your work particularly.
I think we covered everything. I just want to say that we have this genomics initiative that we're undertaking. So we are enrolling families and who have one or more children with autism into a genetic study to specifically look for new genes that cause autism. And yeah, we're excited about it.
That's wonderful. So we will share a link in the comments later today for where you can find information about participating in the trial that she just mentioned. And also, this chat, as usual, will be on our YouTube channel later today. So if you have friends that are on Facebook or you just want to watch it on a different platform, it'll be there. We encourage you to share that as well. In the meantime, I want to thank both of you for your time. This has been a wonderful discussion. You've answered a whole lot of questions, and it's been really wonderful.
Thank you for having us.
Thanks for having us.
All right, well, thank you to all of our listeners for tuning in and asking all the great questions today, and we will see you next time.